Hi, I'm Dr. Molly with Your Goals Physical Therapy. This is National Upright Posture Month. It's very exciting. I love talking about posture. And so this month I have been doing a series on how your posture can be affecting your sport. This week we're going to highlight biking. So biking is amazing. I like to bike around the neighborhood with my son and my daughter, my husband. We have a good time finding the Bayou trails around our house. But normally you don't have too much discomfort other than possibly something that happens from the seat, from just tooling around your neighborhood. It does happen, but I'd say that more often than not, I get complaints of discomfort from people when they're doing miles on their bike weekly. And so I thought I would talk about that. So in this video, we're going to define posture so that we're all talking about the same thing. Then I'm going to talk about the different forces that your posture take on and help you combat while you're biking. And then I'm going to talk about what happens if your posture is not able to sustain the forces that we were just talking about. But because I never end on a bad note, we are going to talk about how you move past, prevent, and recover from all of those exercises, or all of those injuries. All right, so let's get started. So your posture, in a very short note, is how the alignment that your spine is in. So you can have a forward posture, you can have a sway back, you can have all sorts of, you can have tilted, right? So that would be your posture. This is just how your spine is aligned. So, but the big thing for sports is you have to be able to keep your spine stable while you're moving, or something is moving you, depending on what sport you're in. So in the case of biking, you're not really being hit, you're not hitting the ground like you would with running, but you are holding onto handlebars and you are on a seat and you are pedaling. And so all of those, even though the legs is your own body creating some forces for you because you have each leg doing something different. There's a pushing and a pulling, and it's happening opposite on each leg. And then, of course, especially if you're riding around in Houston, there's all sorts of ground forces, right? You got potholes everywhere, cracks, things like that. If you're a mountain biker, you have whatever gravel going up and down terrain, all of those things. So that is impacting you. Then your body has to be able to stay stable against that. So if you have a hard time keeping your shoulders from rounding or collapsing down while you're sitting in a chair, it's probably also hard for you to maintain that upright posture while you're on your bike. One of the most amazing things for me is, even though I really don't go very far, it's very kind of sad actually that I would have any discomfort from riding my bike. But it is surprising when you're holding onto the handles and you're not used to doing that, and you're leaning forward and a good portion of your weight is on the handlebars. And again, we're on trails, so you do have forces that happen from being on the trails or having to go on grass and things. It doesn't seem like it would be much, but if you're not used to it, you actually notice that your arms are tired after a while from holding you up, and you do want to switch positions. I now know why. There are multiple ways that people can hold on to handlebars. And so just being able to hold yourself here and not let this or this kind of thing happen over time while you're biking is very important. So that's one of those forces. Gravity is pushing you down and your body's having to fight that. You're also having to contend as the gravity's pushing you down. You have whatever bump that you're getting from the ground basically jolting you up. So you're having to absorb impact. One's a little bit more startling than others throughout your whole bike ride. And we haven't even talked about what happens at your lower back, because at your lower back, you're having to deal with rotational things because one leg is coming up as the other one is pushing down, and then vice versa. And to make that happen, on one side of your hip, something is contracting, and on the other side of the hip, something is having to get longer. And so all of those forces have to be working in sync, right? And in all the time, like each time it has to be right. So we might not think about it, but that's a lot of ways and a lot of forces that our body has to adjust and adapt. And so making sure that our posture is an optimal alignment for what we're trying to do. It doesn't have to be perfect. We don't have to be anatomical and be like 100% right, but we have to be within a certain range so that we're not dealing with injuring ourselves later. So what would it look like if you did have an injury and it was related to biking, or this could be aggravating it at the very least? So if we talk about our upper body, we'll talk about neck pain. So I know that might seem weird because I was just complaining about wrists, shoulders, and other things, which are all possibilities, but most people would see that as slightly obvious, right? They were holding on to the handlebars and now their wrist hurts, or they really felt it while they were biking and their shoulder was bothering them. That's something that I think people tend to be able to tell me that. But weird things that people kind of miss, especially with biking, is neck pain. And so let me just explain that. So if you're turned down and you're collapsing, then when you want to look up and see where you're going, you really have to extend your neck. Whereas if you were able to keep your shoulders down and then go, it's not as much of a torque on your neck. So you don't really think about that. And while you're riding, it's not like you're staring at yourself in a mirror. So sometimes it's hard to tell if you are falling forward. So the other thing that people complain about is like mid-back, somewhere around this area, back pain. And that is also from that curving. And I will say that is oftentimes also associated with people who have very tight hamstrings and very tight chest muscles and other things. So when they're trying to get into that position, the place that it ends up being the most flexible for them is that like mid-back, like almost directly in the center of their spine. And that's just where they can flex. And so while they're biking, that just puts a lot of stress on that part of their spine. And so that's where some people really they have some severe pain in the middle of their back. And that is directly related to how they're able to hold their spine and how stable it is. So if we're talking about lower legs and we go a little bit lower, we're talking about injuries there. So what would be a common injury? Hamstring pulls. And so I know most people want to blame tight hamstrings on that, and albeit that plays a part in it. If your spine is moving, then that means your pelvis is not stable, because if the thing that it's attached to is moving all over the place, then the thing below it is also going to be moving because it doesn't have a strong support system. So if your hamstrings do have a tendency to be a little bit tight, now you have a spine that's moving too much and things just go wrong. And so really being able to keep your lower back stable while one leg is doing one thing and the other leg is doing another thing is key to keeping you from pulling your hamstring or having an overworked hip flexor. So both of those are very, very common to have hip flexor pain. So it hurts at the top of your hip right underneath your pelvic bone, or you just feel like you just gave yourself a massive Charlie horse or something. You know, it just pulls all of a sudden. It's very sharp, it's sudden, and it feels like, you pulled your hamstring. So both of those are directly related to how stable you can keep your lower back. That being said, if your hamstrings are super tight, that will also play into that. So stretching is always a good thing. And it takes a little stress off your low back as well. So now, how do you combat all those things? I just talked about a whole lot of negative things that happen if your spine isn't great, and I know everybody beats on posture, and we all work at a desk. So the big thing is, obviously stretching is wonderful. If you're gonna be at a desk job and you have to be pulled forward all day, then when you're training, part of your training for being on that bike should be exercises that help pull you back. Exercises that help your upper back muscles, help your rotator cuff, help your overall arm strength and endurance, so that you don't get so tired that you're creating new ways to hold yourself up so that you can make it the distance that you'd like to make it. Abs, abs, abs. Everybody should be doing more ab work. Planks are amazing. Dynamic planks are even better, but there are so many great ab workouts out there that those things really do help you. They truly help prevent injuries. The stronger you are, the more stable you are, the less injuries you will have, specifically with this sport. So if you're having a hard time navigating any of that, by all means, reach out, because I would love to help you problem solve what's going on with you specifically. And if we need to work together, or if you need to do something different, then we can work through that process and get you back to biking at the level that you want to. Well, I hope you're having a great day.